We're here to bear witness to the strength and the stories of the survivors. And we're here to end the stigma and the shame of suicide by not only mentioning the problem, but by naming the hope that is out there right now.
Unfortunately, we live in a culture in which mental health and being called crazy have become pretty common. And in doing so, it avoids the reality of the human being who's suffering, and it prevents some of us from getting close enough to it to be able to put an arm around a shoulder to ask the right question or to help. That's the stigma. That's coming out of the shadows. And if those folks out there who are helpers don't come out of the shadows, at least perhaps we will. At least perhaps we will have the uncomfortable conversation with each other professionally within our own families. Yes, you've come for a professional conference, but you sit in the room as a mom or a dad or a grandparent, an aunt, an uncle, a godmother, a godfather, and some of you sit in this room with that personal hat, worried about your own children. Important information. We are not immune, are we? Simply because of the role that we play. We have suffering inside of our own families. So what we know is, as we can raise ourselves up and feel comfortable with the information, that we can ask better questions and help people get the support that they need. Of all the 50 states, if the number 1 state has the most suicides and number 50 has the least, New Jersey is number 49. It's good news. But you can't use that line when you sit with a family whose loved one took their own life and say, hey, listen, we're 49. They don't want to hear that. We're not done. We're not finished. In any organization, the folks down here cannot be healthy unless the leadership is healthy. Kids can't be healthy in schools unless teachers are healthy. Teachers can't be healthy unless the leadership of the district is healthy. Unhealthy moms and dads cannot raise healthy kids. Others can step in, grandparents, aunts, uncles. But healthy gets affected by the leadership of that organization. See, there's so much we can do about this issue of connectedness and wellness. In your neighborhood, in your home, in your extended family, on the team that you coach, on the scouting troop that you lead. Wherever we go, we have a responsibility, A, make sure we're healthy, and B, help others be so too.